Welcome to AITV News. A new study in the medical journal JAMA, led by researchers at the Children's Hospital of Philadelphia, finds that the overall health of United States kids has slid sharply over the past 17 years. Between 2007 and 2023, children ages 3 to 17 became roughly 15 to 20% more likely to live with a chronic condition than they were in 2011. During the same period, the share of children and teens classified as obese climbed from 17% to nearly 21%. The researchers didn't stop at chronic disease. They also compared United States child mortality with that of 18 other high-income nations, including Australia, Canada, Japan, and Spain. American kids are dying at higher rates than their peers abroad, a gap the authors call a huge wake-up call that points to deep structural problems in the way the United States supports families. Those structural problems show up in day-to-day life. Nearly half of all United States children now receive medical care for at least one long-term health issue. Mental and developmental disorders are rising fast. Anxiety, loneliness, autism, and ADHD are all being diagnosed more often. Asthma is the one chronic condition that has improved. So what's driving the decline? The study finds no single villain. Instead, it points to what lead author Dr. Christopher Forrest calls a toxic environment, a mix of factors that shape where children live, learn, and play. A federal commission known as Make America Healthy Again echoes that view, highlighting ultra-processed foods, environmental chemicals, excessive screen time, and the overprescription of medication as key contributors. The Commission's report compares children's health to a canary in a coal mine, warning that if the youngest Americans are struggling, the country as a whole is on shaky ground. The report has drawn fresh attention to chronic disease, but also criticism for citation errors and references to studies that don't exist, raising questions about its accuracy. Even so, most experts agree on the broad outlines of the crisis. There is, however, room for optimism. Many of the risk factors are modifiable. At home and in school, experts recommend simple steps. Limit phones during class to encourage face-to-face interaction. Set up family charging stations outside bedrooms to protect sleep. And build in more unstructured outdoor play. At the policy level, researchers urge a fundamental shift in how the nation supports parents, pointing to countries that treat childcare as a profession and guarantee ample paid leave after a baby is born. Dr. Forrest argues that solutions must be crafted neighborhood by neighborhood, tailored to the realities families face every day. The decline in children's health is complex, but experts insist it is reversible. Addressing it now, they say, is not only about helping kids thrive, it's about safeguarding the future strength of the nation itself.